Good evening and welcome to our COVID-19 update. I am Ladi Akeredoluale. Here are the highlights for this hour. After PTF go-ahead, Niger State begins preparations towards opening of schools for graduating classes. Ondo State Governor announces he's tested positive for COVID-19, goes into self-isolation. And America's top disease researcher says he won't be surprised if the country sees 100,000 cases a day of COVID-19 as total caseload exceeds 2.6 million. Following the federal government's announcement of the partial reopening of schools across the country, particularly for graduating classes, some stakeholders in Niger State are concerned about the level of the state's preparedness for that. They expressed the worry that the lives of students may be at risk if schools reopen without adequate measures in place to guarantee their safety. At a one-day intersectoral meeting to discuss the possibility of reopening schools in the state, the stakeholders drawn from various sectors identified poor infrastructure, especially in public schools, as a major challenge. Drivers began preparations for interstate travel while observing strict COVID-19 preventive measures in Jigawa State in the northwest of Nigeria. This is coming after the Presidential Task Force on COVID-19 lifted the ban on interstate travel. Our correspondent in Dutse filed in this report on the level of compliance by drivers and passengers on measures set aside by the government. We'll get back to that report in a little while. The Ondo State Governor, Rotimi Akeredolu, has tested positive for COVID-19. The governor announced this himself on his Facebook page. He says he's currently in self-isolation and supervised home management, which will be administered by the team of the state's infectious diseases hospital.
I tested positive, but I am asymptomatic. I'm not feeling sick, neither am I feeling hot in any way. But my doctors have decided that I should take the normal treatments and self-isolate. I believe that supervised home management will be ideal for me for now. Let me assure people that, as you can see me, there are many of us like this that don't have the symptom. And in a few days' time, we'll conduct another test and we'll know the result. Let me assure people that the work is going on. Here at home, attending to files, which is the normal thing I do, and there's nothing that will stop the work going on.
The Ondo State Governor, Rotimi Akeredolu. In neighboring Ekiti State, it may well become the first state in the southwest of Nigeria to reopen schools bearing any last-minute changes and developments. The state governor, Dr. Kayode Fayemi, made this known during a state broadcast today, where he indicated that worship centers in the state may resume for services as from Friday, July the 17th, in line with the agreement reached by the state government with leaders of religious organizations in the state. Dr. Fayemi, speaking on the next stage in the state's COVID-19 response, says arrangements are in top gear to ensure that pupils and students return to school from July the 20th, as recommended by stakeholders in the education sector. He goes on to say that the two largest markets in Ado-Ekiti, Ojaba and DC markets will now be open to lock-up shops only, subject to compliance with protocols, adding that street trading, makeshift stall kiosks, and open displays of wares in the said markets remain banned. The governor announced that the state government has taken a 2.5 billion naira life insurance cover of 2 million each for 500 frontline medical personnel involved in COVID-19 assignments, in addition to the prompt payment of their COVID-19 special allowances to qualified cadre. In Ogun State, Governor Dapo Abiodun has challenged the state public service to adequately rise up to the socio-economic challenges occasioned by the current coronavirus pandemic by redoubling efforts towards the state's economic recovery. The governor promised better reforms in the public service to ensure effective service delivery while assuring residents of good governance, transparency, and accountability. Let's return to Jigawa State now, where we are told you earlier that drivers had begun preparations for interstate travel while observing strict COVID-19 prevention measures in that state. This is coming after the Presidential Task Force on COVID-19 lifted the ban on interstate travel.
Drivers at the Dutse Motor Park have begun preparation after the federal government gave the green light for interstate travel. Vehicles are washed and serviced for the long-awaited journeys. However, the drivers are mindful of the protective measures against coronavirus, as passengers must wash their hands and wear face masks before boarding. The directive by the federal government does not contradict the state authorities, as the Jigawa State Governor has since ordered the opening of the state borders with neighboring states.
Last briefing, we suspended the interstate movement prevention in our state, and we have lifted the borders open in Jigawa State. So that has already been done by Jigawa State. And on the issue of the students that are graduating, we will analyze the protocol and we will adhere to the presidential directives and do same.
As the Jigawa State government steps up its fight against the dreaded COVID-19, hope is that people in the state will sustain the preventive measures.
As the COVID-19 task force in Bayelsa State celebrates the discharge of a total of 100 persons out of 189 confirmed cases in the state, motorists at the Ekeki Motor Park say complying with social distance directives is one of the measures to curb the spread of the coronavirus. But this will lead to a hike in the price of the transports. Our correspondent, Deborah Timiwood, reports.
The motorists and other vendors at the Ekeki Motor Park, which is the major motor park in Bayelsa State, are eagerly awaiting Wednesday, the 1st of July, to begin their daily interstate trips. Now, this park is known to be ever busy. At every time of the day, when you come to the Ekeki Park, you would always see a vehicle that would take you to your destination. But for almost 3 months, due to the ban placed on interstate travels, as a measure to curb the spread of the coronavirus, this park has been missing all its daily activities. The driver says it's not been easy surviving with their families for over 3 months without getting their daily income.
Now, we'll be carrying one at the front for small car, 2 at the back, instead of 1 at the front, 3 at the back. And the Sienna now, they will be carrying 1 at the front, 2 at the second seat, and 2 at the third seat, instead of 1 at the front, 3 at the second seat, and 3 at the third seat. So Sienna will carry 5 instead of 7. White car will carry 3 instead of 4. Definitely, we are going to increase price because the other remaining passengers, the 3 people are the one that will share it among themselves.
I would like to commend the presidency for actually lifting the ban on interstate travel. We all are aware of the inconveniences it has caused, not just for the transport users, that is the drivers, but for all road users who are travelers. It has increased, it caused a hike in transport fare, and then some of our activities were kept on hold for such reasons because some persons could not make it to any of those states who probably business calls.
The state recorded 13 new cases for the coronavirus, while 3 persons were discharged from the isolation center. From Yenegua, Deborah Timiwood for COVID-19 updates.
Residents of Yobe State have commended the federal government and the Presidential Task Force Committee on COVID-19 for lifting the ban on interstate travels. Some of the drivers told Channels Television that the decision will ease transportation as well as costs, as well as also improve the economy.
It's been 4 months since the federal government placed the ban on interstate travels as one of the measures to curb the spread of the global pandemic. Many economic activities were crippled and some means of livelihood in the transport sector partially shut down. On June 29th, President Muhammadu Buhari gave the marching orders to lift the interstate travel ban. While the decision is welcomed by many residents and commuters in Yobe State, they narrate the experiences during the lockdown.
We have suffered a lot, but now that the ban has been lifted, we call on the government to properly inform the security men on the roads to minimize our sufferings. In some places, you have to pay at least 500 or 1,000 naira just to be allowed to pass.
It will give the teeming population of Nigeria the opportunity to travel far and near.
On their own part, the Nigerian Union of Road Transport Workers in the state is asking the relevant authorities to check the excesses of security personnel on the highways.
You cannot pass if you do not give them money. No how, no how. They will pack you for some hours or a day. You will stay there if you do not give them. We had it over radio. President is saying that they should allow those who carry goods and foodstuff to access the road free, but it is not.
Lifting the ban on interstate travel in the daytime will no doubt help to improve the economy. But all laid down safety protocols must be strictly enforced to curtail the community transmission of COVID-19.
In neighboring Borno State, the cancellation of the interstate travel ban has been received with gratitude. The period of the ban had put on hold the livelihood of commercial drivers, as well as others whose livelihoods depend on those motor car drivers in the parks themselves.
An empty park, parked buses, idle drivers. It's 7 o'clock in the morning and the Borno Express bus terminus is quiet, a ghost of its former self. Before the ban on interstate travels, it was a bustle. For 3 months, the gates have been locked, affecting livelihoods of drivers, petty traders and porters. The Ministry of Transport, in charge of enforcement of the safety guidelines, have been engaging transport unions on the need to adhere to safety measures. Transporters will be making their first trip since the lockdown, tomorrow, July the 1st.
The guidelines given has to do with the reduction of passengers to 50% level and the use of face masks by passengers as means of necessity, and as well the stoppage of usage of any air conditioner in a traveling ban. Instead, the windows of all the buses or the cars shall remain open for at least fresh air.
The hand-washing point and mobile clinic situated at the entrance of the city by the Borno State COVID-19 response team becomes handy. With the anticipated influx of travelers, the lifted ban will cause.
We can now go to Borno guest, our guest in Borno State there, and that's our correspondent, Blessing Chuno. Good evening, Blessing. Now, from what you've reported there, it does seem as if everything is ready. But you didn't talk about the fact that fares are likely to go up, like in some of the neighboring states. Thanks for staying tuned. Welcome back to our COVID-19 update. With 566 new cases of coronavirus reported by the Nigeria Center for Disease Control, the NCDC, in the last 24 hours from 20 states, Nigeria's total confirmed COVID-19 cases now stand at 25,133. The number of discharged patients also increased to 9,402. Sadly, deaths were reported within the last 24 hours, bringing the total number of COVID-19 deaths in the country to 573, and that's 2.3% case fatality ratio. COVID-19 samples tested so far in 35 states, as well as the Federal Capital Territory, are now 134,257. The male gender continues to account for the highest number of cases at 66%, while the females hold 34% of the cases in the country. Young people between 31 and 40 years of age are the most affected by the virus. Now let's look at the origins of the infections. Remember, the first one was recorded in an Italian who traveled into the country. So far, 407, that is 2%, of the total COVID-19 cases in Nigeria are those with travel history. 6,344, or 25%, are contacts of those with travel history, while those with unknown exposure are in the majority at 18,382. That's 73%. States with the highest cases in each of the 6 zones are Lagos in the southwest with 10,310, the FCT in the north central has 1,818, and Kano in the northwest has 1,211. River State tops in the south-south with 1,056 cases. Gombe has overtaken Bauchi in the northeast with 503 cases, while Ebonyi leads in the southeast with 438 cases. Consultant public health physician, as well as the senior lecturer at the Department of Maternal and Child Health at the College of Medicine in the University of Lagos, Dr. Alero Roberts joins us via Skype from Ikoyi in Lagos. Good evening, Dr. Roberts. Thank you for your time.
Thank you very much for having me, Ladi. Nice to see you too.
Interstate travels. The federal authorities had kept this on lockdown for a very, very long time. But now they are opening it up. And from some of the reports we've seen already on the program today, it does appear that in some places, they're kind of prepared, right?
Yes, but let's stop deceiving ourselves. What kind of a lockdown did we have? People had been moving in between, and that is why, I do not see, I fail to understand what the relevance is of opening it up now and allowing all this to go on. The problem that we are having now is that, yes, we're in full-blown community transmission. Yes, now they've opened the state borders and people can travel to and fro. But the very important non-pharmaceutical interventions that we're still insistent should happen, I see no preparation for that. I mean, you showed us the Gombe State bus station, and there's one bucket to provide water, sanitation, and hygiene. That doesn't make much sense.
Given the fact, of course, that this is still early days, the major thing that I suspect that you might also be worried about would be the increase of the already established community spread, with people now being able to move around freely from state to state and possibly raise the spread rate in some of the places where currently it might be a bit lower than in other places.
Well, this is the thing, Ladi. We have to look at the mathematics and the science. The truth of the matter is this is a disease that we know that 80% of people will remain asymptomatic despite being able to spread the virus. However, that means that 20% of people will develop symptoms, some of whom can progress to severe and even critical. When you work out the maths, 20% of 200 million Nigerians is 40 million Nigerians. The truth of the matter is we are just not ready for 40 million Nigerians to develop symptoms that may even progress to severe or critical in a very short space of time. Hence, we have been pushing the mantra of the physical distancing and making sure that people do not keep spreading the virus one to another. I mean, left to me, we should also push the mantra of mask up Nigeria, not just mask up Lagos now, but mask up Nigeria and make sure everybody is wearing a mask. The science has proven the value of masking. If I mask and you mask, we reduce the amount of virus that gets into the community. And then, of course, the hand washing. But you see, government owes us a duty of care to make sure that everybody is able to access safe and effective care, because at the end of the day, it is clean hands that saves lives. So we are worried about, we know that the numbers are up and they're going to go up way high. If we have the capacity to test, we would see many, many more cases than we are seeing now. The good thing is that 80% of people still remain asymptomatic. But we are not ready for 20% of the people who will develop symptoms that can become severe or even critical.
Unfortunately, Doc, what has been consistent about the figures from the NCDC is that those most affected are those between 31 and 40. Of all the categories, this category has been singularly responsible for most of the cases. Does this worry you?
The working age, these are the hardest working Nigerians that we have. These are the ones that we are depending on for national development. These are the teachers, these are the nurses, these are the front line, the front-facing workers, the bus drivers, these are the traders. So if they are affected, then we have a real problem. And much as we do need to open the economy and whatnot, we must make sure that they are protected by making sure that everybody in that category has access to safe water and can maintain the physical distancing, to mandate people to wear masks may not be that difficult. I mean, if you make it a law, it will become a law. We now all use seat belts in vehicles. So we have to make it a law that everybody must wear a mask. We must make it mandatory. We must apply sanctions when people are seen in public without a mask. But most importantly, we must make sure that there are facilities for people to do the sanitation and hygiene and wash hands. That means that as you are opening the schools, you must have proper hand washing facilities. You must have proper water supply and sanitation and hygiene. You must have toilets that are clean. You must have taps that run. You must have all these things in place before you say you are opening up the economy.
You've touched on a point that I wanted to raise with you, and that is the one of schools. All along, each time people talked about schools, there seemed to have been a almost near unanimity about not opening them because of everything that could entail. But again, we're biting the bullet, so it seems, by saying, okay, those who have to graduate, GSS 3, SS 3, primary 6, could go back. But it doesn't look as if there is unanimity in the level of preparedness or the belief of people in the level of preparedness, even for that.
Have they made the schools safe? Is there a fallback position? If anybody goes to school and gets sick, what is the fallback position? What is the plan? If you're a teacher in that school, what is the plan? You know, there are some schools that will definitely go back, and they'll go back effortlessly. All the really highbrow international schools will have every facility in place and they can very safely go back. But this furthers the divide between the haves and the have-nots. Those in the lowest strata of the economy, the lowest strata of the society, to have the same opportunities of education and health, then it's very, very unfair. And there are some things that government simply just has to do. You know, yes, we are taking collective responsibility. Yes, communities must do this. But I heard the chairman of the presidential task force this afternoon, and I wondered when he gave an order and said this is the responsibility of the state governors and the LGA chairman to do. You know, you can't give the most important aspect, the most important part of health and education to the weakest arm of government and expect much success. So we have a lot of concerns. What happens when the children get sick in school? Where do we take them? The primary healthcare centers? I mean, these are things that we have to address and things that have to be put in place. And it's not just by merely making a pronouncement from Abuja. We need to see real action on the ground and at the grassroots for us to be able to safely do some of these things that they say we should do.
Thank you very much, Dr. Roberts, Dr. Leo Roberts, joining us from Ikoyi in Lagos. Thank you for your time, Dr. Roberts, and see you again soon.
Thank you for having me, Ladi.
Moving on to Abuja, where another public health physician, an epidemiologist, who is also a retired Director of Disease Control and Immunization at the National Primary Healthcare Development Agency. Dr. Emmanuel Abanida joins us now. Good evening, Doc. Thank you for your time and welcome to the program.
Very much.
Let me have your take on this resumption of interstate travel. I don't know if you heard Dr. Roberts, who's just finished speaking there, saying that, look, it's good to open this up. It was sort of open all along, but that there is a real fear that the facilities are not there to ensure that this can be done safely and cleanly, so to speak.
Well, I have heard what Dr. Alero said about interstate travel and the level of preparedness that Nigerians are putting into it. I believe strongly that the relaxation of the lockdown that we had before, the evaluation, and when we extrapolate it to the next level of the lockdown that is taking effect from tomorrow, we have a lot of lessons to learn. Let me first of all just point out that many people have the contention that another lockdown may not sort out our problem. And even interstate travel restrictions and all the guidelines may, at the end of the day, not sort out all our problems. Because all along, there have been interstate travels, we all know. People travel from Abuja to Kebbi, they travel from Abuja to Bayelsa. All what they need is extra coins in the hand. Because those who are supposed to oversee or to have a foresight to enforce that these guidelines or these laws in quote are obeyed, they themselves are at fault. Now, it is going to be very difficult to really put infrastructure in places for interstate travel the way we have them now. If you want to have good structures, as we have in the Western world, you know, a distance from Abuja to Kaduna, for instance, we have about 3 or 4 lay bays where vehicles can stop and people can freshen up and people can wash their hands and then people can take fresh air. Because if you have to travel for about 1, 2, 3 hours in a crowded bus without enough aeration, no matter the level of the gloves and no matter the level of the face mask you put, there's still that risk there because distancing is not there. And then we know that in the crowded environment, the virus particles, they shed faster. However, because we cannot avoid this interstate travel because of the nature of our economy and the nature of our living, is that people must take personal responsibility. What I believe that government can do is to increase the level of awareness and let people know that COVID-19 is real. People are still doubting it. People regard it as a political disease. People regard it as a disease of the elites, a disease of the big people, because they see in the news and the media that somebody has died, it's a governor, somebody has died, it's this and that. But they have not realized that there are so many people that died that are not reported that are also in the lower class. So I believe that we need a lot of education to all Nigerians that COVID is real. And when people are educated and they know the effect of COVID and what it can do to them and to their families, and if anybody is positive in the family, everybody goes on isolation, then people will take personal responsibility. It is not an easy thing at all. Well, it's very easy to put on paper and say interstate travel, people can travel. I do not see a hike in the number of cases, even when you have, when you do a lockdown now, because the lockdown we had the first time, I'm not sure it was extremely very effective because people were still doing whatever they like. So those are my takes about this lockdown and this interstate travel. Finally, on the interstate travel,
sorry, let me butt in. Dr. Banya, let me butt in and ask you this, because your last point was that, well, they have to do the interstate travel because of the architecture of our economy and so on, that we've got to travel. But if you take that side by side with the fact that this active, as you said, active community spread is going on right across the country, as the figures that we keep reading every day are showing, does it then make sense to exacerbate the situation by allowing this, especially given what we are seeing in other jurisdictions like the United States, in Brazil, Germany, and a number of others where they've gone forward, they've had to come back?
Thank you very much. Let us be very frank and very practical and be truthful. The interstate travel reduced during the last lockdown, but there were people who are still traveling. We are worried that when you institute this interstate travel and people now move, certainly it will have some negative effect on the case count because more people will now be crowded together. I get worried about it. But if you don't have any very organized system where you can track or where you can monitor how people are moving, where you engage the critical stakeholders in this interstate travel process, especially the National Union of Road Transport Workers, the drivers, and so on and so forth, it's going to be very difficult. It is not easy to monitor this. We need to engage those people who are in that value chain, in that interstate travel chain, the drivers, the union, and the passengers, that's number one. Critical also is the need to reorientate our security forces, our law enforcement agents, where they can make everything to be a mess. If you say people must wear masks when they are inside the vehicle and you must take 2 people at the middle, 3 people at the back, and the driver takes 3 people at the back and 3 people in the middle, those extra ones, they are sources of revenue for some of the law enforcement agents. That's the truth about it. And there's some people who say, well, I don't care. You put the money there and I just give it out so that people can have it. So I believe that we need to have a lot of reorientation, both for the law enforcement agents and also for the stakeholders in this interstate travel. Government has a responsibility to make the guidelines, but the only responsibility government has in ensuring that these guidelines are followed is to put the law enforcement agents road and provide the infrastructures as much as possible. And I think since this one has become a normal norm, as people now say, we may have to look at our transport infrastructures. Because studies have shown that when you have long buses or long commuter buses, they are far safer in terms of disease transmission than these crowded small vehicles. But how long are we going to do that one? We cannot say everybody cannot access these long buses. And so those who are using these small buses, small vehicles, have to be well educated that they need to take personal responsibility.
Now, at this point, we do know that you were one of the top shots at the Primary Healthcare Development Agency. You were, in fact, in charge of disease control and immunization. So my next question is right up your alley. How prepared do you think our primary healthcare centers are at the moment for taking, quote and unquote, responsibility if this increasing caseload begins to leave the urban centers and it moves to the semi-urban or rural areas where they appear to be the only health institutions that are available?
That is a big question, and it is, to be very frank with you, I'm not sure that we are prepared all over the country for this. You might have some centers that are maybe prepared, those that are in the urban centers, but those that are deep in the rural areas or far away, I'm not sure they are prepared. I'm aware that the National Primary Healthcare Development Agency has done a lot of training and training of trainings for the primary healthcare workers at all over the whole country, so that they can use the triage system to ensure that, peradventure, people come in, really pregnant women or people that are vulnerable, they come in and they have symptoms or something similar to COVID, what they need to do. God will not allow it to happen. I'm not a prophet, so praying, but I'm not sure that along the line Nigeria is prepared to take the burden of a full-blown COVID, community transmission, and the outcomes in the country. We are about 200 million Nigerians, and by our estimate from the figures we are getting, if you have a full-blown and you expect about 40 million Nigerians to be infected, of course, 80% of these may be asymptomatic, but the remaining 20%, they are there. And if you look at our data for the case fatality rate that we are having, is between 0.6 to about 3.4%. So one may expect that if you have a full-blown in the country, we might be having about 3 to 4 million people dying of COVID-19. That is very scary. So I believe that a lot of responsibilities are still there, and I'm not sure that the primary healthcare centers, without PPE, without all the equipment they need, without the drugs, without the state training and motivation of the staff, can handle a full-blown COVID. We want to raise the bar or raise the line, as you said, by recruiting and ensuring that our health facilities can cope with cases of COVID-19 if there's a full-blown. Trainings have been done, but what is the level of implementation that can be carried out at the primary health care center level? Akin to this is the issue of commodities. You may have training, but the commodities, they are not available. I think the easiest commodity that are available almost everywhere now is maybe the thermometer that you take the temperature, the face mask, and perhaps maybe the surgical gloves and sanitizer. But if you have real acute case, real severe cases of COVID that might need intensive care, primary health care center cannot take care. So they have to be referred to other things. One challenge that the primary health care center also have right now is the issue of rejection, and because of great abundance of care and abundance of caution on the part of the primary health care workers. Anybody that has malaria now is a suspect, or anybody that has a symptom that you cannot tie to anything is a suspect. And so it's going to affect even the level that the primary health care workers are given at those stages. So all the same, I think we are just in a mess if this COVID-19 spreads, the community spread goes beyond what we have now. My take is that I'm not sure that we're going to have more cases that are fresh and that are new. The new cases that we are seeing now, new in quote, are those cases that have not been detected, but they're in the community. But if we reach maximum number of people that could be infected in Nigeria to have the herd immunity, then we're talking of close to maybe about 140 to 150 million Nigerians that will be infected, so that everybody will be protected, except we have the vaccination. So to answer your question and to summarize it, yes, the agency is trying its best to ensure that the primary health care centers are prepared for cases of COVID if it becomes full-blown, but I'm not sure of the level of implementation based on what we are seeing as structures around the COVID-19 disease itself.
All right, Dr. Emmanuel Abanida, thank you so much for your time and for your perspective tonight. Dr. Abanida, of course, is a retired Director of Disease Control and Immunization at the National Primary Healthcare Development Agency, and he's also an epidemiologist and a public health physician. Thank you for your time tonight.
Thank you very much.
The United States leading infectious disease expert, Dr. Anthony Fauci, has said that there could be 100,000 new COVID-19 cases daily if necessary action is not taken across the United States. Dr. Fauci told the U.S. Senate Committee on Health, Education, Labor, and Pensions today that America is going in the wrong direction in the handling of the coronavirus. Our Washington correspondent, Maria Bird, has more.
States in the United States of America have experienced major spikes in COVID-19 cases. States like Arizona, where cases have increased by 260%, and Florida, where young people are the highest number of new cases, are beginning to close beaches ahead of the July 4th holiday.
The increased cases are being driven, a lot of it because you are seeing much more spread amongst the younger demographic. I think that positivity rate, we'd like to turn that and get that going in a downward direction. We are testing a lot more, and so part of this is you're testing in areas you wouldn't have been testing before.
It does require all Texans to go back to those strategies that we mastered. Wearing a face mask, sanitizing your hands, keeping a safe distance.
The White House Coronavirus Task Force gives specific instruction to young people about the need to be vigilant to following social distancing guidelines, and the Secretary for Health and Human Services gives clear strategies for how the U.S. is combating COVID-19.
So let's take a look at this problem that we're facing now, this resurgence of cases. I don't think there's time enough now all day to try and analyze and figure out the multifaceted elements that went into that. You know, everything from maybe opening a little bit too early on some to opening at the right time, but not actually following the steps in an orderly fashion.
We've built up our readiness under the strategy we developed to address surges, save lives, and in time defeat the virus. We're in a much stronger position to support states, hospitals, and individuals as they fight back. There are 6 parts to the strategy: surveillance, testing, containment, healthcare capacity, therapeutics, and vaccines.
COVID-19 has taken a dangerous turn in the U.S. and is disproportionately impacting young adults. This also creates great risk for vulnerable populations that live or are in contact with young adult Americans. From Washington, Maria Bird, Channels Television News.
Meanwhile, Principal Deputy Director of the Center for Disease Control, Dr. Ann Schutzwatz, warns that the United States is not responding like other countries who have shown success in containing the coronavirus and has allowed the virus to spread much more widely and rapidly. Around the world, COVID-19 cases are spiking, especially in Latin America, India, and in South Africa.
Brazil has reported over 24,000 new cases of COVID-19, bringing the national count to over 1.3 million as the coronavirus pandemic continues to rage across the country. In the last 24 hours, 692 new deaths from COVID-19 were reported, raising the death toll to over 58,000. Several U.S. states continue to backtrack on the easing of their lockdowns. The state of Arizona is one of the U.S. states reversing course on reopening its economy due to a spike in cases. The number of confirmed COVID-19 cases in the United States has surpassed 2.58 million. And Britain has imposed a strict lockdown on the English city of Leicester following a local flare-up of the coronavirus, just as Prime Minister Boris Johnson attempts to nudge the United Kingdom. New Zealand's Prime Minister Jacinda Ardern says all borders are to remain closed, despite the European Union allowing residents from her country to travel within its borders.
I do think it is dangerous to suggest that we open up our borders at this point in time. This pandemic globally is growing. The reason New Zealanders have the freedom we have and that we've been able to domestically open up our economy has been because we have kept our borders so tight.
Ardern also said that New Zealand will use virtual digital platforms to host the Asia-Pacific Economic Cooperation Group Summit to be held in 2021.
Of every 5 Nigerians who die from COVID-19, 3 are more than 50 years old, and that's according to the NCDC. Do visit their website to know how much you can take precautions to protect your older relatives and for more on COVID-19 regulations and guidelines. Also do visit the website of the World Health Organization to get the breakdown of global coronavirus cases. Plus, you'll get to see how the WHO is responding to a measles outbreak during the COVID-19 pandemic. For details of how COVID-19 engineered the release of 18 inmates awaiting trial in Lagos, do log on to our website, channelstv.com. The website also has other news on the local and international scenes. All you need to do is log on and access the news in real time. Thank you for watching tonight. I am Ladi Akiridoluale. Good night.